33-year-old Prosi Chazike has had spina bifida, a condition that affects the spine since birth. At one point, Prosi Chazike's condition was too severe, which forced her to go for amputation.
My parents didn't know how to manage the condition, but then unfortunately I lost them when I was around 5 years, and I was raised by my uncle, who also didn't know what to do with the condition. But then he managed to keep me. He took me through education. He took me to school. But while in school, of course, with the condition, you have the incontinence. You know, you're always wet 24/7. I was always discriminated in school. I had, if I might say, maybe I had very few friends. If not, I didn't, because I was always wet. I had urine leaking because of the condition.
Because of her condition, Chazike was discriminated against when she was growing up. Because of her condition, she now depends on diapers, which she says are very expensive.
I was always also segregated. While others were sleeping on mattresses, I slept on the mat. Life was really a mess. I almost gave up on school at one time because, you know, people kept on laughing at me. Diapers were very expensive to buy at that time. I always used nappies for just to attend a class, but still even these nappies, you know, they could reach a time and you're all smelling, so it really became hard.
Chazike is just one of many people who have spina bifida and hydrocephalus, according to Dr. Isaac Damulira from Mbale Cure Hospital. The number of cases related to spina bifida and hydrocephalus are increasing annually depending on the lifestyle, environment and failure of the public to follow the recommended regulations.
In the past, on average, in the past 6 years, we operate almost 1,000 children with hydrocephalus, that is water in the head, and over 300 children every year with spina bifida, which is the problem of the back. This surgery costs about 6.2 million.
Dr. Damulira says members of the public have previously associated spina bifida and hydrocephalus to witchcraft, which is not the case.
Most important thing about spina bifida is it is something that can be prevented. At least we can reduce the risk of a mother having a child with spina bifida by up to 70% only by making sure that these mothers get timely folic acid. So if the foods are fortified and the regulations are put in place to ensure that the right amounts of folic acid are put in these foods that the mothers are going to eat.
Ruth Naluja, the National Coordinator of Victims with Spina Bifida and Hydrocephalus, says at the moment they are caring for more than 12,000 patients across the country.
Multi-sectoral or multidisciplinary care that this child would need throughout her lifetime. And the surgeries are not a one-off. My own daughter had 3 surgeries in the first 3 months, which means every month I was paying 6.2 million shillings, which is really very exorbitant.
Sarah Ngalombi from the Ministry of Health says spina bifida and hydrocephalus can be reduced if pregnant mothers listen to health professionals.
A number of districts, about 30 districts in Uganda, have their children or adolescents that are in their reproductive age and the communities around being given iron and folic acid, a tablet per week, such that by the time they get pregnant, there are chances that they have an adequate status of micronutrients.
Tomorrow, Uganda will join the rest of the world to commemorate World Spina Bifida and Hydrocephalus Day, which aims at raising awareness of the 2 conditions that affect the spine and the brain. The file was compiled by Chris Semalemu Semakula for CTV PM Edition.